I'm gonna hope you can. Okay, I hope that's visible to everybody, but hello everybody. So I would really like to start with thanking the management for inviting me for giving this talk. I'm really excited to present to you about Parkinson's care and especially the digital updates in Parkinson's disease management in the last year to be exact. So a little bit about myself. My name is Asli Beyza Gul, and I am a medical student at Aston Medical School in Birmingham, UK. I'm also the first Parkinson's Foundation ambassador in the UK. So Parkinson's Foundation is based in the US, and I'm the first ever ambassador in the UK for them. So essentially, I represent them here. I'm also a research champion with Parkinson's UK, so I volunteer with them on an active basis. And also, I'm the founder and editor of Parkinson's Care, which is a global platform focused on increasing awareness of Parkinson's disease, as well as sharing the latest updates on Parkinson's. Now, why Parkinson's to begin with? Parkinson's disease is the fastest growing disease, neurodegenerative disorder to be exact, in the world right now. And I remember when I first started researching it, it was about 60,000 people per year getting diagnosed in the US. And now I looked at the value again, and it has risen to 90,000. And that is essentially a 50% increase in a matter of years. So it is very alarming that it is increasing at such a quick manner. But so are the developments for it. So I think it really balances out in that sense. I would like to just continue with, there we go. I'll just remind you all as to what Parkinson's is. Just a quick reminder, it is a progressive disorder caused by the death of dopaminergic cells in a part of the brain specifically called substantia nigra. And this area is responsible for movement especially. And since there's no dopamine produced, that's what causes movement disorders essentially. So no dopamine is produced due to the buildup of alpha-synuclein protein as well. And the toxins from alpha-synuclein protein aggregation results in the death of dopaminergic cells. So the current treatment options that we have for Parkinson's is dopamine replacement therapy, which would be your medication like levodopa and carbidopa. And then also last resort is deep brain stimulation, which is the insertion of electrodes into the substantia nigra to ultimately send electric signals to act like dopamine. Now, deep brain stimulation, although it might seem like a huge miracle, it really is, but it's not an option for everybody out there. There is a huge criteria that each and every patient needs to sit through. And if they obviously meet those criteria, that's when we can actually consider deep brain stimulation. So, like I said, there are a lot of new developments, especially in Parkinson's management in the recent years. And on Parkinson's Care, I talk about these updates. And I tend to, categorize them in lifestyle, research, treatment, and technology updates. But today I will be talking to you only about the technology updates that I think you would really like to know about. So here are the 5 technology updates that I will be talking to you about today. The first one is artificial intelligence predicts Parkinson's 7 years before onset. And then another one is smartwatch reveals invisible symptoms of Parkinson's. Next is artificial intelligence reveals 3 types of new Parkinson's subtypes. And then new symptoms tracking with artificial intelligence. And last but not least, a new method which could advance early detection of Parkinson's disease. So let's start with each and every one of them and go into detail. So there is a blood test which AI can analyze and use it to predict Parkinson's 7 years before the onset of these symptoms. So researchers from UCL in the UK and University Medical Center Göttingen in Germany analyzed a panel of 8 biomarkers across IRBD patients, which is idiopathic rapid eye movement behavior disorder. So 72 patients were tested for IRBD. And it was seen that 75 to 80% of these people with IRBD, they went on to develop a synucleinopathy, which is obviously abnormal buildup of protein called alpha-synuclein, and that points into Parkinson's. So this buildup of protein of alpha-synuclein can essentially result in Parkinson's. AI reveals that 79% of these patients, they share the exact same profile with Parkinson's patients. And after following them for about 10 years, after analysis of the AI, it was concluded that it predicted the clinical outcome of Parkinson's. So these guys with the exact same IRBD profile went on to develop Parkinson's as well due to the buildup of synucleinopathy. This is a really, really good milestone in Parkinson's development, because by doing this, we can prioritize certain patients and make sure that we know that they will be developing, and so therefore provide services as per. Next, I would like to talk to you about smartwatch use in Parkinson's management. So obviously Parkinson's disease is usually even known as shaking elderly, and it's usually associated with motor symptoms such as tremors, rigidity, and bradykinesia. But these patients also come into the hospital with other complaints, and these fall under the non-motor symptoms. And these can be sleeping problems, depressive complaints, reduced cognitive performance, and also urinary problems due to the stasis, since they're not moving that much. So researchers at Radboud UMC in Netherlands, they decided to tackle this, and they advocate for more use of remote sensors, because ultimately when they come to the clinic, patients might not perform as they normally are in real life due to things like white coat syndrome. So you might not be able to get the exact same picture that you're looking for. So by the use of smartwatches and other sleep sensors, these provide reliable results and also less hospital visits. So not only are the neurologists at a advantage with this, they can see more patients, they can provide better care, but also the patients will be at the comfort of their home, and ultimately they will be providing more reliable data for us to tackle as well. So the neurologist that led this, Dr. Bas Bloem, he led this research, and he says that in the hospital, we take a photo of the patient, as it were, while a film provides much more information. So this will be able to provide us with better data, but at the same time, it will be providing us with a continuous control over the patients and seeing what's happening as per how it's developing. So it's a really, really important thing. Next, I'd like to talk to you about these new subtypes that AI reveals of Parkinson's. So ultimately, after research, 3 new subtypes were found based on the distinct patterns of disease progression with Parkinson's. And these are inching pace, which is PDI, moderate pace, PDM, and rapid pace, PDR. So each subtype has unique cerebrospinal biomarkers and brain imaging to go along with it. And this was found after reviewing large databases and patient genetic and transcriptomic profiles at the same time. So it all ties in really nicely. This is really important for personalized treatment, because if we were to know how they're going to progress in the future, we can ultimately plan their medication and their patient pathway way before than the onset of the symptoms and onset of worsening. Another interesting point that was seen in this research was that by examining these databases, they found that people taking the diabetes drug metformin appear to have improved disease symptoms, especially related to cognition and falls, compared to those who did not take metformin. And this was by first author Dr. Chang Su of the research paper. This was more noticeable in PDR, so rapid pace types patients who are most likely to have cognitive deficits earlier on the course of their disease. So this does raise a question as to how reliable it really is, but it is a really interesting point to consider. Next, I'd like to talk to you about this new symptom tracking method with the use of artificial intelligence. So essentially, when a patient comes to the neurology clinic and they present with Parkinson's-like symptoms, we look at the Movement Disorders Society Unified PD rating scale, so MDS-UPDRS, to measure how their disease is progressing as to whether they're mild, moderate, or late Parkinson's. Now, this is a very reliable way because essentially you can make it quantitable, since every neurologist is using the same thing. But again, it's very subjective because one neurologist might agree with one thing, whereas the other might have a different idea. Now, AI in this research, they determine the movement markers for Parkinson's through video recordings for the MDS-UPDRS3, which is the movement of the hand and touching here. In one study assessing motor symptom severity in finger tapping test videos through machine learning algorithms resulted in higher accuracy in Parkinson's diagnosis and severity in predictions. So it makes it much more reliable because it's not like we are referring to one neurologist or the other. But again, it is very, very stable as to how they determine it. So these video recordings, they can actually revolutionize Parkinson's disease management. Patients will be at the comfort of their home and neurologists with better tracking of their patients, so they will be able to provide better care overall. So let me show you as to how it really works. Patient will sit across a camera like so, and then point their hand out and do the motion as per. And then this graph there is gathered. And by doing that, the AI can determine how the disease is progressing in these patients. And then as per, neurologists can see how it's doing and obviously adjust their medications, adjust their pathway as per. Last but not least, I'll talk to you about the new method which can advance early detection of Parkinson's. So obviously Parkinson's is associated with the loss of dopaminergic cells, but also synucleinopathy, so the buildup of alpha-synuclein in the brain. So CapQuick, which is capillary enhanced quaking induced conversion, it is a visual method for detecting misfolded proteins seen by naked eye. This is more cost-effective and accessible, and it's quicker as well. The team demonstrated that they could use glass capillaries like the one in the picture right there, small test tubes designed to hold biological materials to distinguish between normal and disease-associated proteins by observing difference in liquid movement within the tubes. So they will be able to see which proteins are misfolded easily. CapQuick detects misfolded alpha-synuclein proteins in Parkinson's disease, and it simplifies earlier diagnosis, which is super crucial for timely intervention and also better patient outcomes. I share updates like these and even more in my global platform called Parkinson's Care. And if you were to scan that link, you can get access to it and subscribe to it as well. I share the most recent developments in Parkinson's disease at the ease of a click. So I'm super passionate about Parkinson's and I really keep up with it day to day. So I hope that you will join me in a mission to transform movement and also inspire hope at the same time. Thank you so much. You can find my email up there if you would like to get in contact. If there are any questions, I'm more than happy to answer them. Thank you for your time.